tell me about yourself and how I can help you.
I came across your website, which was very helpful, and also your LinkedIn profile, where you have some blog posts about how to get started as an expert witness.
Great.
What I was hoping to get some input from your expertise is to actually try and figure out how to approach more clients, or at least put my name out there. I think I have the experience. I'm just trying to get to know how to actually build a practice around it. I am really passionate about what I do day by day. I would love to continue my day job, but I think that being an expert witness helps me in my day job as well, and I think it complements each other very well. The tricky part is, of course, trying to get into a new venture, so to speak. And I've learned a lot from the Facebook site that you host, as well as the LinkedIn information that you put out. So I was hoping to get a little more information from you about how to actually present myself to new people.
Well, thank you so much for reaching out. I really appreciate it. I think, what you're talking about is so, that's just like exactly what happened to me, right? I was an internist practicing primary care, and, one of my partners couldn't do a case because it wasn't in his area of expertise, so he referred it to me, and then I really enjoyed it. And then that, turned into more cases and things. So I'm happy to tell you, what I know from my experience.
Yeah, one of the things that I've come across from your Facebook site as well as the LinkedIn is potentially to reach out to both defense and plaintiff lawyers, and how to actually present myself. What are they actually looking for? So probably like some information about what from your experience in terms of presenting a cover letter and also a relevant CV.
Right. So I would say, I'm sure you've seen on the Facebook page that there is some controversy about reaching out to lawyers. There are some medical experts who feel that it is very important to never be seen as advertising themselves. And I don't so I attended a training at SEAK, SEAK, and I found it incredibly, useful. And so I kind of defer to them as like the gold standard of advice and recommendations. And the opposing attorney is going to try to use anything that they can to try to discredit you. And just because they ask, have you advertised, it doesn't mean that that's necessarily bad, right? So what would be bad is if you gave the impression that you are selling your signature, or you are willing to sign off on whatever they want. As a medical expert, it is incredibly important that, you make it crystal clear that you are honest, you conduct yourself with an integrity, that you do, unbiased reviews. And so any information or any kind of communication with attorneys would need to communicate that. But if an attorney asked you and said, hey, do you advertise? Say, well, yes, but I still just give my opinion, based on the truth or whatever. So that's,
I think one of the tips that I've come across from other expert witness, there's a lot of discussions around that on your Facebook site from people who are more experienced, much more experienced than I am, is that, it's not wrong to advertise. In fact, all the attorneys advertise. Otherwise, how are people going to get to know, where they are and who to reach out to? And that's kind of how I feel. I work in a fairly small area, which is a plus sometimes, but also it's not in a big city, so there are very few attorneys in my local area that kind of do this. And it's kind of also one of the discussions where you don't really want to work, if you're in a small community, you don't really want to work as an expert witness in your local area, just because the conflict of interest is a lot higher than in a bigger city. So a lot of what I struggle with right now is actually to try and reach out to people in the region, but not necessarily in my little city.
Yeah, so I think, making sure that you could take a look at my LinkedIn, my actual LinkedIn profile. I think I looked at somebody else's who I, was more experienced than I was, and just list all of your experiences, and just make it clear that you are available to do medical expert work. And actually, since I did a really big LinkedIn reboot, like I edited everything recently, I've gotten a lot more inquiries. So just by using some keywords like, expert and litigation, or I don't know, I don't remember the actual keywords. But if you look at my profile, you will get an idea of kind of what I did, and you just need to make sure that that is the same information is in your LinkedIn page that is on your CV. So you may present them differently, like but it's they can't conflict with each other, because that's where an opposing attorney could say, that you're trying on purpose to misrepresent your credentials, and you want to just be clear that everything is the same everywhere. I noticed on your CV, it looks like a good CV for if you're trying to find a job, but I would I don't know, from what I've seen from experts who've shared their CVs with me, they're more like professional CVs that are used for credentialing, where you just list what you've done, you list your publications, you list your organization, and you don't really need to include keywords or interests or anything like that. It's just very fact oriented, so that the attorney, and it should be more than one page. It should be several pages, just listing everything that you've done. All of the quality committees that you've been on, volunteer work, anything like that you can put on there. And so in terms of getting started, I would say, it sounds like which attorneys you want to reach out to, and you could just send them a short message and introduce yourself and just say, hello, I'm an internist, I am a hospitalist, I have quality improvement experience, and I just wanted to introduce myself and let you know that I'm available if there's any cases that come up that you would like an unbiased, honest review of, and I would be happy to serve as an expert witness. So
I like that. I like those keywords, because that's very clear that you're just there to give your opinion. It might not be the opinion that the attorney wants necessarily, or what the client wants, but it's an unbiased expert opinion.
Right. Exactly. And I think also attorneys like it if they have somebody who they can reach out to if they just have questions, because a lot of times as internists, we can provide more explanation for the attorneys that don't kind of understand how all the pieces fit together. So, what you may want to consider, but is even offering to an attorney that you really would like to work with, to say, if you ever have any questions about a case that you can even run that by me. I'm willing to speak to you, for free for, for an introductory phone call, or, or something like that. I know there's one of the experts in our group who's very, very busy. He makes it very clear he charges a lot, but he makes it very clear to attorneys that he does, that the first phone call where he discusses the case, that is free.
Kind of like all the curbside consults we get at the hospital, right?
Correct. I mean, you want to be careful, because you don't want to obviously give your opinion without looking at the records. So you need to kind of couch everything. You can't say, well, that's definitely, medical malpractice or something. You have to be clear that it's, well, if that's what the records show, then, you know, that would suggest that maybe the standard of care was, you know,
breach or something.
breached.
But I guess
Exactly.
we can also kind of put it out in that, you know, from what you're telling me, it sounds like I do have some concerns, but without reviewing the records, I cannot actually tell you if it
Exactly.
is or it's not, because
Exactly.
sometimes, depending on what's documented and what's done, I may have a different opinion later on or something
But
to that
sometimes
effect.
it's helpful to let them know, you know, these are the 3 things I would look for when determining,
Uh-huh.
you know, anytime that a patient has a PE, you know, I want to make sure there's
Right.
no hemodynamic compromise. I want to, you know, I want to make sure they're not on any other blood thinners. I mean, whatever it is, to give them background so that they understand what what they're looking for, because a lot of times they don't know or really understand what the importance are.
And that was something that was mentioned too, like maybe attending some of the CLE events on Zoom, like right now, you know, that's kind of what everyone is doing. But also potentially, I guess what, you know, I think that's a good thing to kind of put together. The other thing I'm wondering, and I know that we have only a few minutes left, is you have a website, and I'm trying to figure out, I actually have built websites myself for other reasons in the past.
Yeah.
I'm trying to figure out the pros and cons of it, because we kind of talk about this too, it's the beginning of the conversation, right? Is that considered advertising? Or, you know, can it be a website that I just direct the attorneys to and they can find out more, but not necessarily like put it on Google search or something, or
Right.
Facebook, you know, like
Yeah.
not really advertise it, but have it available. So do you have any good thoughts about that?
You know, I think that that you could go either way. I think that that some attorneys like having a website that at least lists your credentials, and this would make you easier to contact, because that's
Uh-huh.
going to be another thing, because attorneys are looking for experts. So the easier
Right.
you are to find,
Uh-huh.
then that makes it easier for them to to use you. So
Right.
I mean, the downside, I suppose, of having a website is you have to keep it up to date. You want to
Mhm.
make sure it doesn't look, you know, I've seen some websites that look really, you know, crummy, and then you just sort of wonder, you know, I would, if you're not, if it's not going to be like a nice looking website, then from my
Mhm.
perspective, because I'm like a very aesthetic person, then I would
Mhm.
just do LinkedIn. You know,
Okay.
you
Okay.
don't need it, right? Everybody's on
Right.
LinkedIn. Um,
Right.
but but there are some advantages. You can put a blog out, you know, you can keep track of, you know, the attorneys that you've reached out to. You can send
Mhm.
a newsletter. I mean, there's different things that you can
Right.
do. I don't necessarily do all these things because I just don't have the time.
Right.
But
Right.
those are all things that are reasonable to do. You
Okay.
just have to be careful that whatever you say, again, you're making it very
Mhm.
clear that
Right.
you know,
Right.
your opinion is not for sale.
Right, right. Well, I think that's been helpful. I'm going to get started, and then if you don't mind, reach out back to you. And I think this is perhaps helpful for other people starting out as well. But I do really appreciate your time. And